top 4 things you can do today to improve your heart health and your brain health to help prevent and reverse Alzheimer's. Dr. Joel Kahn is going to share with you some amazing information about the usefulness and importance of vitamin C, niacin, checking your calcium score of your heart arteries, coronary arteries, and looking at a blood test called Lipoprotein a. Stay tuned for an amazing episode with Dr. Joel Kahn, MD. Hi there. I'm Dr. Josh Helman with Alzheimer's Breakthrough, and today's guest is incredible. It's Joel Kahn, MD, one of my heroes. He is very smart. He graduated summa cum laude from University of Michigan, and he's a professor at Wayne State in Michigan, and triple board certified. Author of many books.
Actually, 5 times, but we could talk.
Author of many books, including, should I say it, Vegan Sex.
Yes.
The cover was risque enough with fruit, including a banana and oranges, that he actually had to cover up the cover when he was selling it in his restaurant in Michigan when that existed. So, and the contents were amazing too. So I could spend an hour just talking about Dr. Kahn. It is such an honor to be here with you today, and let's get started.
I agree, and I thank you for that kind introduction. And knowing you for a long time, I could go on for an hour talking about your training and accolades. So, mutual fan club, but let's break through some information barriers and heart, brain, and anything else you want to touch upon.
Definitely, yes. So this is a podcast on reversing and preventing Alzheimer's. You're a cardiologist, and how much Alzheimer's are you seeing, and what is your approach to these types of issues or patients when you see them? And yes, you have a busy practice in Michigan, and I know in the winter you were in Boca Raton in Florida too. So yeah, go for it.
Very kind of you. I think if you went back, I've been practicing 35 years, old man that I am, but still lots of energy. And would ask me 15 years ago, did you seek out and investigate people's memory with an eye towards making a diagnosis of early cognitive impairment? Answer was no. It happens. Cardiologists see a lot of the elderly. Memory impairment isn't exclusively a disease of the elderly, but it obviously is one of the diseases of aging. But now it's been a routine, and there's just so much overlap. When we're treating the heart aggressively to keep it young, I like the term young at heart, we're treating the kidneys, we're treating the bones, we're treating the brain. It's all a network. I'm not sure I could even think of something right now. I'm sure there is. That's good for the heart, bad for the brain, or good for the brain, bad for the heart. I mean, you talk sleep, nutrition, fitness, weight management, blood pressure management, advanced lab testing, hyperbaric oxygen. I mean, anything that you go to from investigation to therapy, it's a win-win, heart, brain. And the heart's obviously the source of vascular supply. The brain is a very vascular organ, and you need to think about how rich and healthy your blood supply to your brain is. And you can do that by investigating the heart. The side benefit is you'll actually know where you stand in terms of your personal risk of future heart attack or something worse and more tragic called sudden cardiac death, just falling over dead.
Wow. And again, I know you have your own podcast, and I have a whole list of questions here. And I know each one of these questions, you could spend half an hour, because I've heard you on your podcast do that. But just to stay focused here, When I was back in medical school 35 years ago, I learned about something called heart rate variability, and it's developed into a whole science in the last few decades. Is that something that you use in your practice to measure the age of your patients' hearts?
To some degree, I actually was doing research on heart rate variability about 40 years ago as a resident at the University of Michigan Medical Center. Some very early, interesting clinical work on measuring heart rate variability in type 1 diabetics and their prognosis. And we described in a series of papers that having an abnormal heart rate variability in a young type 1 diabetic was very concerning. And not an easy thing to improve either. It's an autonomic neuropathy of the heart. Makes you very prone to arrhythmias. And again, that terrible word, sudden cardiac death. So I've been in this space a long time. So many of my patients wear Apple Watches, Oura Rings, Whoop bands. They're bringing me their heart rate variability data. There's a cool little patch, if you want to, you put by your left breast called the Leaf patch. I think it's LEIF. It's supposed to be a little more accurate. There's also now, see if I can come up with the name, Morpheus, a band. Looks a little bit like a polar strap, MORPHUS. Supposed to be very accurate for heart rate variability. You don't wear it all the time. You just put it on for 5 minutes in the morning. There's a bunch of tools. It's not a huge part of my practice, but I would consider very important. And low isn't as optimistic as high, but you really are gauging it against yourself, not so much against the person on the treadmill next to you or all. And then what I do in my clinic, some people listening will know about this, but I really promote Heart Math, which is a phone app with many published research papers in children and adults and PTSD and learning disability and hypertension and ADHD and others. Heart Math is a breathing program that can improve your heart rate variability, because it's one thing to measure it. It's another thing to, influence it towards the positive. So that's what we do in my clinic.
That's awesome. So next question that follows that is, I see many patients with Alzheimer's, dementia, who also have atrial fibrillation. And in my mind, that's an emergency. Normally, atrial fibrillation is something in terms of electrical system of the heart that is normally fixable and you want to fix because from a selfish brain perspective, it improves normally blood flow to the brain. What is your approach to atrial fibrillation? And do you have the same sense of urgency that I have when I see a patient with AFib?
Yeah, I'll say something. I know we want to stay out of the weeds and politics, but I got beat up, bashed up on all the social media platforms in 2019 when I suggested that President Biden's long-standing chronic atrial fibrillation, which was in his annual medical report, he was on Eliquis, a well-known anticoagulant that a lot of patients use for persistent atrial fibrillation, might have something to do with the fact he was stumbling on some words in 2019. Whoa, that was not well received. A number of years later, we're pretty clear cut that he did have some cognitive impairment. It's not really a political statement. It's a medical statement. And, he's had some head trauma, but he's had chronic atrial fibrillation, I think, since 2003. That's a long time. So it turns out for anybody, let's move past our former president. Atrial fibrillation sets up a situation where you can have large or small clots within the heart, usually the upper left atrium, and they can break loose. We call it embolize to little vessels, or if they embolize to a large vessel, you have a clinical stroke. But little vessels, and just pick away and pick away and pick away at brain tissue. There are multiple studies that make an association, not a perfect causation, between a population with atrial fibrillation and a population with cognitive impairment. So I think it's real, and you need to do a deep dive. For example, you have atrial fibrillation, you need a sleep study, and sleep studies are absolutely crucial for people with any cognitive impairment. Anyways, home sleep studies are so easy and inexpensive to do nowadays. It's pretty much routine in my clinic. Heart patients have more sleep apnea. Hypertension patients have more sleep apnea. Obese patients have more sleep apnea, and certainly atrial fibrillation patients. So we just do a sleep study in people's own home with a device that's disposable and quite accurate. Being on a blood thinner isn't fun. A lot of people need one for fibrillation. So there is a mechanical device some people qualify for called a Watchman. You got to go through insurance. You got to find the right cardiologist. And it puts a little device permanently in the left upper heart so that some people can come off blood thinner but still have quite good protection from these little clots forming. But also, it's a sign of some disease generally if you have atrial fibrillation. Sleep disorders, blood pressure disorders, metabolism disorders, weight disorders, previous heart attack, previous weakening of the heart called cardiomyopathy. So it's never just a little thing. We now see some long-distance runners that are developing atrial fibrillation, people on super high-dose omega-3 fatty acids fish oil that seem to develop a little more atrial fibrillation, people post-COVID vaccines. We're seeing more atrial fibrillation in some of these people, and none of it's good.
No, it's not. What about just the sense of urgency? Because unfortunately, I see some patients who are like, "Oh yeah, I have atrial fibrillation. I take a blood thinner. I'm just going to live with it." Do you have the same passion, or like let's get to the bottom of this and let's try to fix this?
Well, I certainly have the passion to get to the bottom of it, trying to find a root cause that might possibly be correctable. Overactive thyroid, hyperthyroidism, but pretty much everybody with atrial fibrillation has had their thyroid panel done at least once recently. And if not, please do it. There's an urgency to evaluate. Some people that are asymptomatic, the best choice is blood thinner. They don't feel it. It's not interfering much. They're usually not that active anyways. And we just got to work on the rest of their health status. There is a procedure. I do procedures in cardiology, but I don't do this one, called an ablation, where you burn certain segments of the left upper heart, hoping to prevent or resolve fibrillation long term. But a lot of people need a second and even a third ablation. There's a lot of radiation involved. Technology is improving, but yeah, if you can get rid of AFib, I didn't mention alcohol, a trigger in some people for sure. We call it holiday heart syndrome.
Sure.
It's St. Patty's Day and you're knocking them down with the guys, and then you're in the ER with your heart racing 160 times a minute. Or gals, I don't want to be gender specific on knocking down things on St. Patty's Day.
Wow. And I am kind of talking in the weeds here, but I see this so often. I'm curious more about the electrical system of the heart. Have you seen, or do you frequently see, for patients being treated with antibiotics, changes in their electrical EKG? Because sometimes I'm seeing changes in the QRS, the repolarization of the heart, or the QT interval.
Yeah, that simple, 130-year-old test called an electrocardiogram. That was another medical school research project of mine, because University of Michigan was one of the premier places in the world for early electrocardiography. It's such a simple little test, but those little measurements and those squiggles, you already said, can be measured in many antibiotics and other drugs, antifungals. You've got some, unsightly toenails and you get put on stuff. You better get online and look up if you've got any drug interactions. Maybe have an electrocardiogram. I agree. Certainly some of the antibiotics, the quinolones like Levaquin, can do it, and others. So yeah, that is definitely true. We can image the brain. We can image the arteries to the heart. We can image, muscles, other parts of the body. The electrical system of the heart is there working. That's why your heart's beating 70 times a minute. That's what shows up on the electrocardiogram, the electromagnetic forces created by the heart contracting and relaxing 60, 70 times a minute. But you can't see the electrical system on the heart by MRI, by CT, by PET scan, by ultrasound. You just, it's one of the rare systems of the body you literally can't image, even on autopsy, which is the least desirable way to find out how your electrical system is. You can't really image it. So
I guess the best you could do at autopsy would be maybe take the tissue of the conduction system and look at it under the microscope.
it's been done, of course, as you know,
Right.
but it's not a routine autopsy finding. And we hope to treat our patients so we're not giving them news at the autopsy suite.
Exactly. Wow. So along those lines, in terms of imaging and detecting blockages of whether it's the coronaries using CT scan or getting an ultrasound of your carotids, how has those types of tests changed your practice in terms of allowing patients to see, like, hey, this is not a theoretical issue. This is, you've got some blockages there that we need to fix.
Yeah, and I'm glad you brought that up. These are your questions, but I always hope for that one. I'm a fanatic that if we're getting mammograms and colonoscopy and we're doing prostate evaluations in 45-year-olds, we're ignoring the number one killer of men and women in the United States. And if you have a heart attack at age 60, you had heart disease at age 45. It takes years to develop to the point your arteries are 95% blocked getting a stent. But we ignore the issue and we assume, if you thought about it logically, there must not be a way to take a 45-year-old and figure out if they have silent disease that's on its way. So we can wrap all kinds of aggressive attention, hopefully lifestyle, but drugs if needed. And it turns out that's a misconception. There are tests, and you mentioned one. It's not perfect, but you can do an ultrasound of the two arteries of the brain. Well, there's actually four, but there's two big ones called carotid arteries. And if you're 44, 45 years old and you got plaque, you have disease. You didn't have that when you were 18, although there are some 18-year-olds living in Louisiana in a very famous research study that did have plaque even at age 18 because of Southern diet and terrible lifestyle, blood pressure, blood sugar, cholesterol, fried foods, and the rest. So that's one way to get it. There's a special kind of carotid ultrasound we do in my clinic called CIMT, Carotid Intimal Medial Thickness Test. Little hard to find a place that does it. It's a little more accurate than the standard one done at a hospital or a cardiologist's office. But the real ticket to success here is the heart. And the heart's hard to image. These carotid arteries are big, straight arteries that don't move. So you could just take an ultrasound probe without any radiation and see them really accurately. But the arteries of the heart, number one, the heart is this annoying habit. It moves 60, 70 times a minute vigorously. The arteries typically have a bit of a serpentine transition, and they're small. They're not nearly as big as carotid arteries. So you can only see heart arteries using X-ray technology. MRI and PET and ultrasound doesn't do it. You can't feel them. So you really are at loss without a CT scan. And in 1990, University of California, San Francisco, they developed a CT scan to see heart arteries very easily, very safely, painlessly, without injecting anything. And that was called a coronary artery calcium CT scan using a software called the Agatston score. And all of a sudden, you could lie down, go in a CT scanner, hold your breath, be done in 15 seconds, no pain, and find out a number. 0, you're in good shape. Turns out your brain's in good shape too, at least in correlative studies. And if it comes out 274 or 682 and it goes up and up, you got a lot of calcified plaque in your heart arteries. You got the disease. Maybe playing pickleball, but you have the disease and you should get serious about it. Your risk for future heart attack, bypass, stent, or death may be the same as somebody who's already had bypass or heart attacks, depending on the number. So that became widely available in the mid-1990s, no insurance coverage, limited research, about a $1,500 test when it came to Michigan in 1995. Turned out my brother owned the machine, so I tried to convince patients they should find out if they have silent heart disease. And not many did at that price. And within 5 years, it became a commodity that any hospital could do. And it brought the price down to currently about $100, 10 seconds, still painless. The amount of radiation is far less than a mammogram even. And people have to know, there's not even any reason to consider otherwise. Around age 45, is their calcium score 0? is their calcium score 114. You need to know that number. It's so simple. If you're a 0, I recommend you repeat it in 5 to 7 years to see if you stay to 0. I'll be turning 66 very soon. I'm still a 0. My very recent follow-up scan. I'm proud of that. A lot of good, nutrition and fitness, even though the hours have been, sizable. And if you're very high, we got to pursue that massive workup of why, and work on lifestyle education and maybe, aspirin or other antiplatelet agents like nattokinase and blood pressure, blood sugar, cholesterol, lipoprotein, little a, the genetic cholesterol, and on and on. There's a whole big workup. In just a couple more comments, in 2010, a new CT scan was developed called a CT angiogram. Now they put an IV in and they inject you with dye looking at your heart arteries. Now you can actually see non-invasively, just an outpatient 10-minute test, more detail, like how narrowed are your arteries, how much we call it soft plaque there is, hard plaque. And that test in the last 4 years has really been crushing it in people who want to know the details of their heart. There's a artificial intelligence software called Clearly Health that can take those quick pictures, 20 seconds, and really determine and measure for us exactly how much narrowing, how much plaque that's pre-heart attack plaque, and we can get more intense. So just this week, and I know this will come out in a little bit, it's amazing. 35 years we've had these CT technologies of heart arteries. One of the very first randomized studies out of Australia took asymptomatic people between the age of 40 and 70 who had a relative with a heart attack or bypass. They all got calcium scoring. They even all got that CT angiogram with the dye, but half of them didn't get the results. Even the family doctor didn't get the results. Crazy. And the other half got the results, and if they weren't normal, 0, they were put on a strong cholesterol-lowering medicine we call atorvastatin or Lipitor, and a lot of lifestyle education. At the end of 3 years, the cholesterol was much lower if calcium scoring was part of the routine clinic evaluation. And the amount of plaque in the heart arteries was much lower because they did a follow-up of that CT angiogram. So we're kind of celebrating 35 years later. We have a reasonably good study. Now, it wasn't big enough. It wasn't long enough to say we prevented heart attacks, strokes, bypass, and stents. We'd have to have 10 times as many people for twice as long. And I don't think that study is going to be done, but I'm glad we got one academic study to make primary care doctors, gynecologists, endocrinologists, everybody start ordering these scans. You just got to write it on a script. Coronary artery calcium CT scan.
Got it. And do you think with that script, people can get the more sensitive intravenous contrast one, or do you think it's still too new, or what are your thoughts there?
I've not yet seen a number, but if I were to estimate, less than 10% of, let's say, 50-year-olds are being recommended to have the $100 coronary artery calcium score. We got 90% deficit there. So I still teach, let's just get the $100 test for everybody. And if it comes back really worrisome, then we can move ahead to the more expensive, more involved CT scan. I don't think we're ready prime time to be offering the more expensive, more involved CT scan with iodine to everybody. But enough people are hearing about it from Peter Attia, MD, and Tony Robbins and other people. I have some patients tell me, skip, the Buick. I want, the Maybach. I want
the best. I want the most expensive.
Well, if they're willing to pay for it and they don't have an iodine allergy, I'll play the game with them.
And if they've got normal kidneys, yeah.
Yeah. Right. There you go.
So the next question is, it sounds like it's obvious. If someone has a very high calcium score, lots of calcification in their coronary arteries, you know what to do. What do you do when it's not the most severe case you've ever seen? Maybe it's a score of 50 or 100, but there's definitely some plaque there. How concerned are you, and how concerned should people be when they do have some calcium building up in their arteries?
Yeah, should be concerned, remembering that, awful statistic. I actually read it in a book yesterday. that if you combine, let's see if I can get this right, World War I, World War II, Korean War, and Vietnam soldiers died, it's 425,974, remembered. And if you just take 1 year in the United States, more people die of cardiovascular disease than that. It's incredible. The burden. Now, some are 94 years old, and they're at the end of their life, but a lot are tragic early deaths. So, yeah, any score over 0, but, in that 40, 50 range. The other factor we didn't mention is age. A calcium score at age 82 of 40 is not a calcium score at age 42 of 40. The younger person, that's extraordinarily out of range. There are databases to put in your age, your score, your gender, and you get your percentile, assignment. So I'd be a little less concerned, might even congratulate an 82-year-old that they are in the 21st percentile, pretty low. But I'd be very concerned about the 93rd percentile for that 40-year-old or 42-year-old I mentioned. So that's part of it too. But we're going to do a big lab panel. We're going to do a big lifestyle education panel on the fact that we've got 70 years of data that nutrition, and it's always plant-based nutrition, can halt or even reverse some of the plaque in arteries throughout the body, along with fitness and sleep and dental health. Let me give a shout out to really good dental health. If you got a bunch of root canals, get them examined because they're a source of infection and inflammation. So I'm going to get excited. If you had a 5-millimeter precancerous colon polyp, do you think you might eat more fiber and go back for your repeat colonoscopy? Sure.
You better.
It scares everybody. People don't get as scared about heart disease, but I want to scare you.
That's good. And along the lines of reversing heart disease with lifestyle, what are your thoughts on oil? Because I know oil in the diet can be controversial. There are people like Dr. Esselstyn that says, like, no drop of oil ever in your diet. And then there are others who are more permissive. Where do you fall on that scale with your patients?
Yeah, I thought you were going to bring up the awful seed oils, the Satan of 2025.
but I'm not asking just about seed oils, but oils in general. Yeah.
Yeah. As much as I completely respect, admire, and love a famous Cleveland Clinic physician, Dr. Caldwell Esselstyn, just passed his 91st birthday with amazing continued practice counseling patients. He's a hero to all of us, where he, identifies predominantly 2 research studies, one by a cardiologist I know well, Robert Vogel, I forget the other, that within 3 hours of a high oil sample meal or sample food source in research studies in young people that don't have heart disease, you can detect some transient decrease in blood flow called endothelial function. It's not permanent, it's transient. On the flip side, there's a very large research study in Spain called the CardioPrev study. Now, these are real heart people. They've all had heart attacks, 1,002, not 20 like the other little one-day research studies. And these 1,002 patients were followed, randomized for 7 years, big study. And half of them were told to have 5 tablespoons a day of olive oil in their healthy, low saturated fat Mediterranean diet. And half of them were told to keep their olive oil under a tablespoon. And they were able to keep them pretty well separated. And there was massive benefit to having the higher extra virgin olive oil dosing in these actual heart patients in terms of plaque, in terms of endothelial function, and actually in terms of events. They actually had to stop the study early because there were so many fewer events in the olive oil group. Now, there's a few criticisms. It's Spain. They love their olive oil in Spain. There was some olive oil industry funding just to give these people their olive oil and such. But it was one of the most impressive studies. So I'm permissive in my clinic with olive oil. And the other reason I am is people get so bent out of shape. That's not a medical term, but everybody knows. that, their social life is so impaired that it really does detract from the big picture of why they're on the planet, which is obviously to stay healthy and live a long life, but in part it's a social creature that we are. So I don't like to see them that stressed out by having, they won't go to a restaurant. I used to own, you may know this, Josh, I think you do, a couple really healthy plant-based restaurants. And we made an oil-free menu just for the people that were adhering to Dr. Esselstyn or Dr. Ornish. And frankly, despite it being unique, pretty much in the United States, nobody wanted it because people that were that concerned just eat at home.
Right. They were too worried to even go out to eat.
Right. Exactly.
Wow. So along those lines, in your practice, Dr. Kahn, are you doing genetic testing? And if so, when? And then which types of genes are you looking at? I'm just curious.
Yeah, one of them you'll relate to, but I call my big three. I usually run my labs through Quest. There are, more detailed genetic panels, but I do ApoE in essentially everybody. And a lot of people have heard of apolipoprotein E. And I've got that 5% or so of people that inherit the double whammy of ApoE4, that puts their cardiovascular risk up, their tolerance of saturated fat in a bad position, but obviously really defines a much higher risk of future cognitive impairment, and try and use it as a positive springboard to get them reading and studying and their lifestyle and their weight and their sleep and all the things. Then there's an obscure gene called 9p21. Nobody even knows exactly what it does in the body, but statistically in databases, it's the most common abnormal gene in people with coronary artery disease. So people are saying, why do I have heart disease? Look at my lifestyle. You do that one, you find it's very common. 20% of people are homozygous. And then the last one is the famous, it's not actually a gene, lipoprotein little a.
Well, you wrote a whole book on it.
Exactly. I don't have it right here. A genetic cholesterol that 20 to 25% of people inherit from one or both parents. You actually check the blood level. You don't actually check the genetic makeup. It's easier to do the blood level. There's a lot of variance in the gene. But, so many people that have high calcium scores and unexplained heart attack find out in my clinic that they inherited a very powerful additional cholesterol molecule in their blood since they were an infant. And we have a strategy how to bring it down. And there's some literature that says high lipoprotein A genetic cholesterol. That's a $20 blood test everybody should have when they get the $100 calcium score. Package price, $120, can't beat it. But there's some connection to cognitive impairment. If you've inherited lipoprotein A, you probably got, a more susceptibility to vascular dementia.
So if you have someone with a very high calcium score and you've done those 3 genetic tests and they're all coming back negative, do you start looking at other genetics, or let's just go ahead and treat you? Or
yeah, I don't personally. I don't think any of the others have an easy path to influence treatment. So we're just going to get, the fitness and the sleep and the dental health and the diet and home blood pressure cuffs. I mean, that should be mandatory for everybody. If part of the Make America Healthy program, to me, it's not promoting beef tallow. Buy everybody a home blood pressure cuff and give them a tax discount to use it. Because we find so much, poorly controlled blood pressure that impacts the brain, the heart, sexual organs, leg organs, the whole gamut.
It makes perfect sense. So Dr. Kahn, I know you go to a ton of different conferences. You read lots of journal articles. You review them on your podcast. What technologies are most exciting to you that you've run into or expect to see in the next, 6 months? What excites you when you open up a journal article or go to a conference?
That's a good question. Because really, if you see like techniques, I had the pleasure of hearing you lecture about your Port St. Lucie Alzheimer's treatment clinic. And, there's a lot of overlap. When you were talking, I was saying, yeah, we do that too. I'm quite bullish on hyperbaric oxygen therapy.
Nice.
There's right now more data for the brain than there is for the heart, but there is some for the heart. It's not widely available and it's not insurance covered, and we need more data, but I'm optimistic. There's some data that in congestive heart failure, it's helpful. You're an expert on therapeutic plasma exchange. I'm optimistic, although that's another non-insurance covered big intensive procedure. It's going to prove useful in heart disease. I'll tell you a couple simple things. I'm still, I'm a student for life. I know you are too. And I've just spent the past 3-4 months reading everything I can get my hands on about Linus Pauling, PhD, who won 2 Nobel Prizes on his own, the only guy or gal to ever win 2 solo Nobel Prizes. And in the last 25 years of his life, which he died at age 93 in 1994, he became very interested in nutrition and decided that something called orthomolecular medicine, or using the correct dosing, but also can call it megadose vitamin therapy. Particularly, he's most famous for vitamin C. And, humans don't make vitamin C. There's 99.9% of animals on the planet make vitamin C. Humans can't. We lost an enzyme in our liver called GLOW. It's there, but it's shut off. I'd very much like to figure out, using CRISPR technology, how to shut mine back on, or turn it back
safely
on.
Yes.
Yeah, well, there was a way to do it. I would do it, insert a little plasmid or something. And so we can't make any vitamin C. It's been estimated if we could, we'd make about 20 grams a day, 20,000 milligrams a day. When we're sick, we might make 30 to 40,000 milligrams a day. And our government says take 90, and some people take a 500 milligram tablet, which is probably better than doing nothing. So I've been sprinkling vitamin C knowledge to my patients for a long time, but more than ever, that's when I'm still getting my last few grams of vitamin C down, because I'm about 10 grams a day right now. And I've done a lot more, but I think I'm going to settle in at around 10 grams. Another one that gets me excited, it's been a little project, is niacin, vitamin B3, also called nicotinic acid. The first agent ever shown to lower cholesterol, 1955, 70 years ago. But it does everything right. Lowers total cholesterol, LDL cholesterol, triglycerides, raises HDL cholesterol. And it's about the only thing we have right now that lowers lipoprotein a genetic cholesterol. And it can lower it a lot. So I've been using it for that purpose in the 25% of my people that have lipoprotein a and want to make an effort to bring it down until we get FDA-approved drugs a couple of years down the road, maybe. But it turns out some fascinating data about niacin in mental health, schizophrenia, ADHD, degenerative arthritis, and maybe longevity. There's the very famous research study in the 1970s called the Coronary Drug Project. Over 8,000 men who had a heart attack randomized to 5 arms of cholesterol-lowering treatment. 4 of the arms were a bust, but the niacin arm lowered heart attack, stroke, bypass, and when they followed these people up, it actually lowered death rates significantly. Now,
nice.
It's just not a popular, cheap. Boy, it's cheap. Pennies.
It's cheap. It might cause a little flushing, but it goes away.
A little flushing, which if you keep going, it goes away. Yeah. So I don't think I'm going to change the entire cardiology community to go back to niacin, but I think there's really a strong base to add a little more vitamin C, a little more niacin to your life. These are inexpensive supplements. I do them as a powder. I just put them both in the same water jug.
That sounds great. We've covered so many different topics. Dr. Kahn, what do you think are the most important 3 things that we talked about?
Number 1, I love the hashtag. I didn't make it up, but I claim I did. Test, not guess. If you're listening to this podcast and you don't know about a coronary artery calcium score, it's at every hospital in your community. You got to get a doctor to write you a script for it. Shell out $100. Find out real deal where you stand from about age 40 up. So that's definitely number one. Number two, lipoprotein little a. It's little genetic cholesterol. Doc tells me my lab work is great. And, I'm eating big salads and oatmeal. I'm bulletproof. Well, if you don't know your lipoprotein A status, you're not bulletproof. I hate to tell you. I'd like you to be, but you're not. Third is the heart and the brain really live in the same neighborhood of self-care. And the earlier you start, the better. Trying to get that good sleep without interruption, sleep apnea. Trying to get to your home or gym or walking or some activity nearly every day, and trying to stand and move as much as you can during the day. Plant-forward diet. Call it the Mediterranean diet. Call it the Mind diet. Call it Dr. Walter Longo's longevity diet, or follow Dr. Ornish or Dr. Esselstyn like I do, but eat a lot of colorful, crunchy, fiber-filled foods, and just stop listening to these crazy carnivore and crazy keto people. They are crazy.
Yes.
I think those are the big three.
That's great advice, Dr. Kahn. Where can people find you on social media and in the real world? Yeah, how can they find you?
I am physically in Detroit suburbs, the great state of Michigan, 10 months a year. And now, as you kindly mentioned, Boca Raton, Florida for January and February. I'll be back in 2026 if everything lines up as it should be. drjoelkahn.com, www.drjoelkahn.com. Take it to my clinic, take it to my podcast, take it to a bunch of blogs. And we see people from about 25 states by telemedicine. And some people are kind enough to actually fly in.
Well,
so all the biggies, California, New York, Texas, Pennsylvania, Ohio, Illinois, Nevada, we can reach out and take care of you if you want. And just want to keep you healthy.
And then on social media?
Everywhere except TikTok. I'm not a TikTok guy. But most of it is on Instagram at DRJKAHN.
Thank you so much. This was amazing. I appreciate your time.
Well,
and wisdom.
You're kind. It's good to share good thoughts. You keep doing good work because you're changing the world, Dr. Helman.
Well, you're one of my mentors and teachers, and it's been amazing what I've learned from you and growing the knowledge. It's amazing.
Thank you.